afternoon and thanks for joining us. I'm Judy Simpson. Being able to live independently at home is important for many people. That's especially true as we age. Home is where we feel most comfortable, and aging in place is a priority. But it's also true that some of us need extra support in order to live safely at home. There may be an illness or a physical limitation that compromises our ability to do so. Help is available in a variety of forms. For over 100 years, the Visiting Nurse Association has been helping people live safely at home as they cope with an illness or other health concerns. This afternoon, we're going to learn more about the support that's offered by the VNA. Joining me are two members of the VNA of Chittenden and Grand Isle counties. Catherine Holdway is a clinical director for VNA's Adult Day and Private Care Services, and Christine Wernicke serves as the organization's Business Development Director. Thanks again for being with us today. So let's start, Christine, with what services are offered by VNA and what can people do to help Vermonters stay in their homes?
Most people know VNA Services because they've had an illness or maybe they were hospitalized. And at that point in time, their doctor or someone from the hospital orders some nursing care or therapy care for that individual so that when they go home, they can rehabilitate and recover safely in their own home. And we know that people being able to go home and recover is really the best place. It's also the most preferred by individuals. They want to go home, they want to recover at home, and they want to get that care at home. So we provide nursing care, physical therapy in the home, occupational therapy, and speech therapy. We also have programs for people who are seriously ill. So we have our palliative care program, and then for those who are at end of life, we provide hospice services. So, and I also want to point out that home is really wherever that person is living at the time. So it can be in a traditional home in a community, or it could be in a nursing home, or it could be in independent living or assisted living.
And so how do people access the services that you're talking about?
So most generally, the VNA would get an order from a physician, and then we set that person up for care. However, there are a number of other services that we provide in the community where individuals can reach out to us directly. The thing I want to point out is when services are set up through a physician, typically those services are covered by that individual's insurance, and that includes Medicare, Medicaid, or a private insurance, maybe through an employer or through a retirement program. The services that we can also provide, which include nursing care, as well as some home support or our adult day programs, those services can be accessed directly by a family member or the individual calling us and inquiring about those services.
And of course, there's a cost associated with that.
There is, and generally those costs are going to be very flexible for individuals, and we can work with that person to identify the needs that they most need and then control that. So for private care, for example, we can set up services for as little as a couple hours a week, and that would be less than $50.
And so what are some of the things that are provided? I know light housekeeping can make a huge difference for someone who is at home and can't quite get around.
Right, and Catherine, I think, can speak to the specifics about the private care services.
Okay.
For private care, we provide what we call personal care attendants, and they can go in and help people with a variety of things. They can help with light housekeeping, they can help with personal care needs, they can help with transportation needs if people aren't driving anymore and they need help with their errands or getting back and forth to doctor's appointments. They can help with companionship. They really are there for a variety of things to just help people when they're no longer able to do certain things for themselves in their homes.
And so that must be a relief for family members.
Absolutely. They really appreciate knowing there's someone there with their loved one. And for the client themselves, sometimes it's lonely.
I bet. Well, are there some barriers or obstacles that prevent people from seeking these kinds of services?
I think one of the things that people find when they're thinking of starting services is just scary, thinking about having somebody, a stranger, in their home, and people are often concerned about having somebody they don't know coming into their home. And our program is set up really very, we think about that a lot, and the way we set our program up is that we think about how we can best match our caregivers with our clients, and we've done a lot of work on that, and we call our clients on a regular basis to connect with them and make sure that the match that we make is a really good one. So within 24 hours of a first visit, we check in with our clients to make sure that the match is a good one, and we regularly connect with them.
Which is really important, because obviously if you don't feel comfortable with someone who's coming into your home helping you, then that's not really maximizing the benefit.
Absolutely, yeah.
And so essentially you offer direct support to individuals and also indirect support to family givers, Christine?
Yes, and I think one of the things that many family caregivers recognize is that when they get to the point where they're talking with their loved one and saying, we really do need some help, our care comes in, and we not only directly support that individual, maybe the person who's having difficulty preparing their own meal, but we're also working with the family to help them understand sort of what's happening. And all of our caregivers are very highly trained, and will tell the family, you know, I think perhaps we should have maybe a nursing visit from private care to assess the plan of care right now. And so we're really a team, and working with that family to support their needs and helping them to understand, because we see this frequently. Many times families don't know what to ask for, they don't know what to look for, and they're not sure what to expect. We hear so often from families what one of the things that they like most about VNA care in the home is that we tell them, this is what you might expect next. And that helps a lot with anxiety of trying to understand what this process is going to look like, caring for a loved one that's aging.
Because, I mean, obviously it's new to everybody in the family, so to have that sort of heads up saying, you know, don't be surprised if.
That's right.
Must be a huge relief.
It is.
It's also very stressful, too, to be a caregiver.
It is very stressful, and we especially find that with, you know, the adult children, or maybe a spouse who maybe not in a great health condition either. And so worrying about that person is also part of the care that we provide, and making sure that that caregiver is supported. We have training, and Adult Day actually provides quite a bit of support for individuals, because when their loved one is able to go to the program, they have that respite time. So they have time away where they can focus on themselves.
Well, let's talk about that. Who might consider Adult Day as an option?
We have a variety of different types of clients that use our Adult Day program. There are clients who have physical disabilities and have difficulty getting around and need help during the day. They may need some nursing care. They may need help with their medications. We have clients who have mental issues. They may have depression, and being home alone during the day is not good for them. We have clients with dementia. We have a special program that's devoted just to dementia, and our site is really well suited for those clients. And so there's a variety of different types of clients that will come to our program, and the program is a fun place for them to be. It's geared to people who have a variety of needs.
Can you describe what a typical day looks like for someone in an Adult Day program?
Sure. They arrive in the morning, and everybody starts their day with a good breakfast. Meals are a very important part of our Adult Day program, and they're homemade and very nutritious. And whenever I visit with the clients in Adult Day, they always tell me how much they enjoy their food. And then there's activity programs throughout the day of various kinds. People can opt in or opt out depending on what they want to be doing, but there's usually choices of things they can do. And depending on the site, there's various different things, but we have art programs, we have music programs, we have exercise programs, we have gardening. Gardening's a big part
Nice.
of our
Flower arranging.
flower arranging. Yeah.
Yeah.
There's lots of different kinds of things.
Well, that's really important too, because I know from personal experience with an older family member, she just wouldn't eat. She just didn't occur to her to cook and didn't want to cook for herself. That was no fun. So to be able to go someplace and have great food available, and then also the stimulation of other people that you can talk to, walking around rather than just sitting is hugely important.
I think the camaraderie and the friendships that go on an adult day are fabulous. I know every time I go down there and I spend time with the clients, I have a good time just for a few minutes. It's just a really fun place to be.
Catherine tells a story about visiting the program one day, and they were doing some dance.
Right.
You want to tell that?
Yeah, they were doing just for fun, they were doing a pretend wedding, and they got to the part that they were doing dancing, and I got up and I asked one of the clients to dance, and she was quite elderly and she had a walker, but she was able to dance with me.
That's
she
great.
said, "I haven't done this since I was 16.
Oh, nice.
Yeah.
So now you have several different locations.
Yes, we have one at Prim Road in Colchester, and there's one in Williston at Blair Park, and there's another one. Our dementia site is in South Burlington.
Well, it's well documented that in Vermont and around the country we're seeing a rise in dementia and cognitive impairment. What services can help people living with these conditions stay at home?
What services?
Yeah.
Well, certainly the services that we've been describing, the adult day service that we have is fabulous because it allows their caregivers to go to work during the day, and it allows the clients to stay at home with caregivers who don't get burned out.
And also, two caregivers who are have a heads up, sort of an eye for some of the warning things that they need to worry about as far as furniture placement or that kind of thing.
Yeah. Go ahead, Christine.
Yeah, I think there's a lot that we're learning about helping individuals and families that are coping with a dementia diagnosis, and the Adult Day program really offers that support for families. I've heard numerous times different stories of family experiences where maybe the spouse kept saying, my wife, she keeps doing this thing and I don't understand what's going on. And so because he communicated that to the caregiving team and our nurses and support staff at the Adult Day program, they watched to see, well, let's see if we can see something. And they actually figured it out, and they were able to come back to him and explain what was triggering her behavior. He then was able to change the environment and his actions at home that made her feel all of a sudden much more comfortable. So, communication styles, learning those cues. I just have to go back and reinforce that this team care concept, that's really, I think, a valuable piece, and we hear it so often that the family caregiver doesn't feel so overwhelmed.
Well, you have expert eyes helping you, experts helping you there. That's someone that you can call, which must be huge if you notice something wrong.
Exactly.
We also have support groups to support the family caregivers that happen once a month at our Adult Day site as well.
Now, how would you suggest that a family or individual begin if they're interested in private care services or the Adult Day program?
They should give us a call. We are available. They can spend a day at our Adult Day program. They can schedule time with our private care nurse to review their care needs, and they can call us. We'd be happy to talk to them. They can call us at our main number at the VNA at 658-1900, or they can visit us online at our website at www.vnacares.org. And they can either ask for private care or our Adult Day manager, and we'd be happy to talk to them.
It's important to take that first step, though, to find out more information about, because there is help available.
Absolutely.
And they don't need to know what specifically to ask for. They should think about calling and saying, this is my need, this is my situation. It's up to us to help them find that right fit.
Get them some information.
The right services. Yeah.
All right, thank you so much for joining us today. That's our program for today. Thanks for joining us. I'm Judy Simpson. We'll see you again next time on Across the Fence.